Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I am pleased to be joined by Sarah van Kuppeveld. Sarah is a registered psychologist and the owner of the Collective Healing Center in Edmonton. Sarah specializes in attachment trauma, group trauma healing, and also works with ACT and ecotherapy in her practice. Welcome, Sarah. Thank you for being here today.
Yeah, thanks so much for having me.
So I always start with a really brief intro because I would love to give you the opportunity to give a bit more information about yourself and your professional experience. So I'll pass it on to you.
Absolutely. Yeah. Thank you so much for having me. So as Amber mentioned, I'm a psychologist here in Edmonton, and a lot of my work, like the focus of my work is working with trauma and supporting the healing from that, but doing that individually and also with groups, which I love. And then I've expanded my practice to include ecotherapy and other kind of modalities as well in terms of group work to provide different exposures for folks and ideas of how they might want to tailor their healing to be. And so I own a group practice, which is the Collective Healing Center. And there's about 15 therapists here now too. And I would say probably 90% of them are also focused on trauma and healing and have their own trainings. And so it's a beautiful group of practitioners. And then in terms of training, I also work somatically. And so I've done a lot of work in sensory motor psychotherapy and Hakomi, and enjoy bringing like the body and the mind together in practice, and find that that's been really effective for healing and post-traumatic growth.
Amazing. Yeah, there was some really interesting stuff on your website that we'll get into in a second here. One of the great things about this podcast is that we get to talk about different types of therapy and expand on different things that people might not have heard of. And we haven't ever talked about ACT on this podcast. So I'd love if you could explain what that stands for and what it is.
Absolutely. So ACT, or ACT, is the acronym for Acceptance and Commitment Therapy. And so at its core, it's kind of a therapy that incorporates acceptance with a lot of mindfulness, with just the goal of kind of getting folks unstuck and increasing psychological flexibility. And it's one of the first trainings I ever took, and I really enjoy it because it has so much in it that I find that anyone can really relate to a certain aspect of it. So some folks enjoy the mindfulness, others enjoy kind of the metaphors, some enjoy the values work of it. And so it's quite diverse in terms of application. And kind of the core of it and the work that it does is it believes that if we're able to bring awareness to something in the presence of like a connected, compassionate human, then we're able to meet it and accept it. And that allows it to shift and change. And so what always comes up for me is that quote from Carl Rogers about like the curious paradox is that when I accept myself just as I am, then I can change. And so it kind of comes from that place of, if we're not forcing or pushing or resisting, then there's actually this beautiful space for change to occur. And I love that piece of ACT. And then in terms of its application with trauma, it's similar to other approaches where it wants to bring clients to kind of be present and be grounded, then to go back and explore like painful memories, images, or emotions, and then to kind of plan for the future, right? What's the life they want to lead and how do they move forward integrating their experiences? And one of the things that I use it a lot for is something called interoceptive exposure. So it's like a big word, but it essentially just means when a client's sharing their story, we're also asking like, what's happening in your body? Are there any images coming up? And so it's kind of looking at what are the leftovers from the trauma in this moment, and being able to kind of like clear those out, accept them, work with them, not like push them away or or hold on to them too tightly. And that's been really powerful to watch of like, oh, I'm like a client will be like, I'm shaking as I talk about this. Like, oh, just let your body shake, let yourself notice it, and it'll kind of naturally settle without us resisting or pushing. So it's really neat and has so many like tools and different applications. So that's kind of ACT in a nutshell. I'm not sure if you have more questions about it, but I could probably go on and on.
Yeah, I do. I this is why I like asking therapists for their definition because it's a far more beautiful definition you just gave than what we would get from Google. So I really appreciate that. I'm wondering who is a good candidate for ACT or ACT.
Yeah. So I found that ACT is kind of it's almost like a really good candidate for folks that are looking for processing trauma and also very concrete tools. Like it's a beautiful blend of those two things. So it's really nice because you do a lot of work in session, which is hard, but then there's also these tools that they can take outside of session and feel kind of productive in the meantime. So I think it's been helpful for people that are needing that. I found it really effective for like attachment trauma, single incident traumas. And then there's so much research for it being supportive for anxiety and depression and relationships and shame and this vast kind of list of concerns folks may have. Just I think again, because it's so big in terms of theory, there's all these different components. So you can kind of like customize it to what the client's needing.
That makes sense. Um, let's talk about ecotherapy. I can guess what that means, but I'd love if you could explain if somebody's coming to your practice and they want to get into ecotherapy, what exactly does that look like?
Totally. Yeah. So it is kind of how the name sounds. And so it's just a therapy that integrates natural elements. So often people understand that to be outdoor therapy, but it actually doesn't have to be. So I live in Edmonton and it becomes -40, -50.
Right.
And so ecotherapy in the wintertime looks like kind of my office, like bringing in natural elements into the office. So perhaps bringing in like rocks for grounding. I've had folks really enjoy like the mats of rocks you can get from Home Depot and they can like plant their feet on that when we're processing something, which is beautiful too. And then we're bringing water into session. So kind of those fountains, and there's a bit of a metaphor for letting go and things keep moving. And so you can bring it into the office in winter, but often what I do is kind of dedicate it to the summer months and going outside. So in my practice with individuals, that looks like a lot of walk and talk therapy, which is neat. It works well for teens because it takes the pressure off of that clinical environment. And then it's also really beautiful for what we call like bilateral processing. So I know you've probably
Yeah.
touched on EMDR in past podcasts of like that bilateral, like one side of the body to the other. And walking does the exact same thing. So it's that bilateral movement, which can be very regulating and soothing for clients. So just that aspect of getting out for a walk is healing. And then with clients who are really interested in expanding more on that, we'll incorporate nature into the session. So an example of that is I had a client who was really struggling with just regulating and kind of like self-soothing was really hard. And so we did these exercises where she would sit up against a really big tree and kind of feel that the tree would like held her weight and was really solid and steady, and she could really lean into that. And it provided just a different sense of regulation, co-regulation with nature. And she took that with her and found trees in her neighborhood and used that really like readily. And then the other one that often resonates a lot is when clients are wanting to let go or there's grief or loss, we can use nature for that too. So maybe like releasing leaves down the river or watching like that movement keep happening with a lot of intentionality. And I feel like nature just has endless possibilities. And I I almost like sometimes call it my co-therapist. I'll be outside and we'll be talking about something like a client who's anxious because they want to have a lot of control over things and they can't. and then it'll start pouring rain or there's thunder, and it's kind of this neat like metaphor of, oh look, we like here we are again, we couldn't control what was going on and how do we respond in this moment. So it's neat to bring in those organic pieces that occur as well.
That is very interesting, and I actually didn't consider that you could bring nature inside. So it sounds like it's super accessible because you could do it inside or outside. Are there certain demographics that you really recommend this type of therapy for, or do you think anybody can really benefit from it?
I think it's like anything that it kind of has to be aligned with what the client's needing, right? So clients that are drawn to CBT because they're pretty cognitive or strong thinkers, they're going to be drawn to that. Clients that enjoy the outdoors might be drawn to this. So I think it needs to come from the client's willingness. One of the neat things is I've had the privilege of learning from a lot of Indigenous elders and a lot of their like healing practices. And so I do find that a lot of Indigenous folks enjoy this type of work. And I think for them, it goes bigger than just being outdoors, but it goes to kind of reducing that power differential of we're both walking alongside each other on this journey. I'm not sitting in my office with a clipboard or
Right.
creating that like colonial environment. So I find it fits really well for them. And then yeah, and teens as well enjoy it. I think a lot of trauma, folks that have experienced a lot of trauma, being outside can be refreshing too. It can kind of keep things moving, be a little bit less intimidating, and kind of almost like something bigger, right? It's like, oh, we're part of nature and we're part of something bigger. And so that can be soothing and reassuring as well. For yeah. So I don't know if that answers your question. I think it's whoever's kind of drawn to it is very much drawn to it and it works really well for. I think clients that aren't interested won't be the ones I do this with. So I don't, yeah,
Right.
have
Yes,
experience
that makes sense.
with it. Yeah.
Okay, I want to talk about attachment trauma. Um, I know attachment gets talked about a lot online and in the mental health space, and I don't want to say it's a buzzword, but I think it gets used in a lot of different arenas when it comes to mental health, and I want to talk specifically about attachment trauma. So, can you explain, in your opinion, what attachment trauma means?
Yeah, absolutely. So I think just to get to that, I'll just start with kind of what attachment is and then add the trauma piece onto it. And so from my kind of learnings and understanding, attachment at its core is just how we connect with others or how we are in relationship with others. And this is based on like all of our previous relational experiences. So from childhood, those ones have the most profound effects. So from childhood, adolescence, as we move into adulthood, and all of these layers kind of create these patterns of interaction or behavior in relationships. So that's attachment. And then what happens is for attachment trauma, if this is normally in like the formative years, kind of growing up, if we don't have like a consistent, reliable, supportive caregiver, our attachment starts to get disrupted. And so then what happens is like in our little minds when we're little, we create what we call like working models of relationship. So maybe you learn, oh, I can't rely on other people, or I can't trust other people, or if I have a big emotion, I have to be by myself, or no one cares. And so you develop kind of these beliefs around others, and then you carry that with you as you grow up. And so a lot of attachment trauma or attachment disruptions come from not like one incident, right? Like, oh, your dad was really mad and slammed the door and it was really, really scary. That's scary and impacts the kid. But where we see attachment trauma is this chronic, kind of ever present, like almost like a slow burn. Like there's this continuous wounding that's happening, and that can
Mhm.
come from like chronic physical, sexual, emotional abuse occurring in those really close attachment relationships when we're little. And then it has so many impacts, right? It can be hard to regulate. It can impact sense of self, and then how we just relate to other people. Yeah,
That's a
yeah.
really good definition. Thank you for that.
Yeah, and then
Um,
ties into just to like tie it all together too. I know complex trauma is often like buzzworded around too.
yes.
And so the way that ties into it is complex trauma, in my understanding, is an attachment trauma. So like that lack of attachment relationship with a whole bunch of single incident traumas layered on top. So it gets really big and really complex as it kind of grows throughout time.
But as you were describing it, that's exactly what I was thinking in my head, is that it sounds very similar to complex trauma. So yeah, it does make sense.
Yeah.
Um, I noticed on your website that yourself and others in your organization do group work as well, as you mentioned when you were discussing your practice.
Mhm.
Um, we haven't talked about this either on the podcast, and there's obviously a different dynamic with group as it compares to individual therapy. So if somebody's never been to group before, and I know for some people that can seem really intimidating, but what would you say that, like, if someone's coming to a group session, what would that look like for someone for the first time? What can they expect?
Yeah, that's a great question. I feel like that's such a barrier is there's a lot of fear and uncertainty around groups. And that's where we start with people that are interested is we do a bit of like just like a call, right? Of, hey, this is what the
Right.
group's about. This is what you can kind of expect. So giving people an idea of what it looks like and explaining it so then they can leave and make a decision of if it's a fit for them. So during that call, what we talk about is the style of group. So there's kind of two different styles. One is a processing group. So that often is a bit less structured. Folks kind of come in, whatever shows up in that group collective is shared and worked through and processed in that space. And then there's the second type is more like structured psychoeducational groups. So there'll be a little bit more like teaching or an exercise or like a coping skill or something that's taught by the facilitator. And then folks have a chance to share about that, ask questions, relate it to their own experience. So there's a difference there as well.
Hmm.
And one of the things that we do to create safety in groups is we make um, the group's really specific. So one of the ones we ran recently was burnout for first responders. And so there's a safety there of, hey, everybody coming to this group has these shared experiences of being a first responder, of feeling burnt out, and it kind of already unites the group. There's such a risk of saying like, hey, here's an anxiety group. And you might have a
Right.
6-year-old and a 60-year-old, and it's how do you create group cohesion when there's such a broad spectrum of who can attend. So that's one of the
Right.
pieces too, is how do we ensure that folks are a good fit for a group and that they relate to that collective? And so, yeah, we do that call. They can check out if it feels like a good fit. And then I think the beautiful thing is on the first day of group, we've seen this over and over again, is everybody's nervous.
Right.
Especially if it's the first time. And so we kind of share in that with a little bit of like a sense of humor and use that first group just to ease into it of how do we get familiar with each other? What are we needing from this group? And then as sessions go on, it becomes like so, I don't know, so natural and easy and there's depth involved in it. And then when the group ends, often folks are really sad and they miss each other and like don't want to leave that space. So there's a lot of prep work. That initial call, we do a long intake, one of the facilitators does, so that if you're coming to group, you either will know myself, the facilitator, or the other person facilitating. So there's at least one familiar voice and friendly face, and then you get to know the other members. So kind of easing into it a little bit too.
Right. Um, what would you say are the main benefits for group sessions versus an individual session?
Yeah, I think there's lots. And so I and I don't know if this came from COVID or it's just the time of like my almost 10 years of being in this work, but I feel like there's a lot of isolation that folks
Mm.
experience. So with their mental health or with what they're going through, and it can be isolating generally. And then coming to individual therapy, yes, you're sitting with a therapist, but you're alone in that. So I think the most brilliant thing about group is that there's other folks who maybe have a similar or shared experience. And so there's this immediate sense of, oh, I'm not alone in this. Um, and that connectedness can be really beautiful. Um, and then and I just find groups kind of create their own like resources and types of support, and that's nice to see as a facilitator of I can only offer so much, but they get it better than perhaps someone facilitating. And so there's this sharing of experiences and learning and growth and this support as you go through the process. So you're not alone in it. You're being witnessed in it, which is really powerful.
Hmm. This might be a hard question to answer, but is there anyone who you would say would not be a good fit for a group?
Yeah. So depending on the group that we're running, there's often like exclusion criteria, and that's just to maintain the safety of the group. So one
Right.
of the examples is if someone's like very much struggling and they don't have a lot of stability, like perhaps they're new to therapy or they're just starting on this journey, they might benefit from some individual sessions just to ground and to stabilize and start that process before coming into group. Um, and so, and then I think depending on the group, there's different exclusion, like different criteria, right? So if we're doing like a group for new moms, it's like, well, there's obviously going to be folks that are not invited to that space to preserve who's actually intended to be there. Yeah.
Right.
So I think anything, and I think it's a lot of the time up to facilitators, but I think if it reaches a threshold of this is a lot, there's a lot happening for an individual and they need that like one-on-one support.
Right.
And that could be like really high suicidality or significant kind of mental health concerns that are really new and they're just figuring out how to navigate those. We want to make sure they're stable enough and safe enough to join group, not only for the
Right.
individual, but also for the other members that are there too.
Yeah, that makes sense. Um, so one of the programs that we run at Breaking Free is we do free support meetings, and I want to make the distinction that it's absolutely not group therapy because we
Mhm.
don't facilitate with therapists, and there's a very big difference between what you do and what we do, and you're professionally trained, which is the important thing. We call ours like therapeutic group instead of group therapy because we're just supporting each other in that space. But we do see a lot of success in that program. So
Mhm.
I guess I'm just sort of curious as a professional what your perspective is on, even without a structured therapist, why the dynamic of a group is still beneficial.
Yeah, that's a great question. I think it's that relatedness, right? If we can connect on some level and develop this understanding, then there's this beautiful potential for change and empowerment and support and those kind of self like run groups of everybody like peer to peer on the same level. There's not that power differential. So sometimes you can see that there's a little bit more like openness to sharing and authenticity and um, the group kind of does its own process without anyone getting in the way or interrupting that. So I think it has so much potential just to be heard, to be understood, to be seen in it. And I also would argue that folks coming to it have a willingness and a readiness to show up for themselves, but also to show up for others. So to go back when I think about attachment and wounding and healing relationships, that can almost mirror like a new family system or a supportive network that maybe was missing in childhood that they didn't have. It's like, oh, I shared and people listened, or I spoke and someone really understood me. And that can be such a beautiful missing experience,
Right.
not only for what the person is talking about, but also for the relational dynamic that maybe they didn't have growing up. So it can kind of be healing on so many levels of the topic, the relational piece, and just the
Right.
collective. Hey, I'm not alone in this. And some people might be further along the journey than I am, and maybe they can, come carry the load a little bit or give me some guidance of which path to take next so I don't have to make the same mistakes or fall off the cliff or whatever that might be.
Yeah, I think uh, being witness to the group dynamic is super magic for a lot of the reasons you just said. But I would say some people that attend our group, because we are like we work with trauma support, which is a super wide net. But there's plenty of people who come to our group that also will go to really specific targeted groups, like you mentioned, like burnout for first responders. We've had people that come to our group, but then they'll go to a group just for men, or they'll go to a group for sexual abuse victims, and you pull something from both of those dynamics. So I think it's just a really interesting opportunity for people. And I just really wanted to touch on that because we focus so much in this podcast about like individual things that people can do one-on-one with the therapist, but there's so much benefit to a group thing too. So I really appreciate your perspective on that.
Absolutely. And it's like we're not meant to heal alone, right? So when you're with a therapist, that has an impact of being witnessed, but there's this added vulnerability of being seen by like 5 or 10 other people, and it almost amplifies that of like I shared something that maybe I've never spoke about before, and you can look around a room and there's tears or people nodding their heads or these beautiful like empathetic nods, and how reassuring and validating and healing just being witnessed can be.
Yeah, absolutely.
Yeah.
What are some of your favorite trauma resources or support avenues that you often recommend?
Yeah. One of the ones that I keep coming back to is I don't know if you've ever heard the name, but her name is Manuela Mishka Reeves. And so I can send you it if you want to put it in the notes too, but
Yeah.
she's a senior Hakomi trainer. And so she's done a lot of work in like the somatic kind of healing field in the States, but she recently developed like an entire trauma program, which she kind of just determined is good for clients to work through and also for therapists for their learning. And so it's lovely. Like I took the training and it's very informative and wonderful, and it incorporates like exercises throughout. So kind of doing your own healing while learning, which is neat. And then she has a book as well, like the somatic psychotherapy toolbox. And so that has a lot of exercises for supporting
Amazing.
trauma in the body too, which I think you can buy it online or download a PDF. And so that's kind of the one I've been into lately, and not so much trauma based, but I've been really enjoying Kristen Neff's work lately. So that's a lot about self-compassion. And on her website, she has tons of recordings. And so you can listen to those and experiment with them and see how they feel. So that's neat. It's a free resource. Anyone can listen to it. So that's been really good too.
That's great. I love hearing about new things.
Those are both new for you.
Both new. I haven't heard of either, so that's super exciting. Amazing. Is there anything else you'd like to share before we close?
I don't know. I think thank you so much for having me and for creating this podcast. I've also listened to the episodes and learned from other therapists too. So it's neat to have this information shared and hear about how other people do this work, and kind of talking about that connectedness. That's what I feel when I listen to the podcast is, oh, other therapists are supporting clients and doing this as well. And that's uniting and connecting and feels less isolating in this work. So it's, yeah, beautiful. Thank you so much for creating it and sharing the information. And I think the last thing I'd say is just for anyone looking to kind of start their healing journey, that's like really brave and really scary and takes a lot of courage. And it's okay to find the therapist that you're looking for, right? The first few might not be a fit, but find someone that you feel like you can connect to, like their modality resonates with you, that you feel a sense of, I can maybe feel safe with them, because this is vulnerable work and we want to make sure you're like in good hands and it feels good to you as well. So you don't have to go with the first one. Yeah. So I don't know. That's all I'd like to say. And thank you so much for having me.
Thank you. Those are beautiful words to end on, I think, actually. I really appreciate you being on the podcast. So thank you again for doing this. If any listeners would like more information about Sarah and her practice, please see our show notes. The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.